Hi, Dr. Julius Hyatt from the Maryland Center for Oral Surgery and Dental Implants. This is our March 27th Friday edition of the COVID update, just to keep everybody informed of how we're managing things here at the Maryland Center. So currently we're only seeing emergencies defined as somebody with severe pain, swelling of a dental origin, or some type of dental trauma or maxillofacial trauma. So we're just holding tight. Anything else that's not causing pain, swelling, infection, we're going to put off aside until things are up and running again. It's going to be at least another week for things to be up and running on a more routine basis. We're going to see people routinely, and we're looking forward to that happening, but that's obviously a fluid situation, and we'll see how things go with that. There are measures we're taking to minimize risk to everyone. Now, the risks we're talking about, obviously some type of infectious disease process, and we want to make sure that we're doing everything possible to minimize risk to our patients, their family members, and my staff and their family members. So please bear with us when it comes to some of these things which under ordinary circumstances we would not need, but this is not an ordinary situation. First of all, if any member of your family, not necessarily the patient, but any member of your family has an upper respiratory tract infection, we don't really want to see you. Obviously, there's a possibility that could be the virus, and we want to minimize the risk to anybody in the office, my team, our patients, and their family members. We want to minimize that risk. So if you have a fever, or somebody in your family has a fever, we do not want to see you, because there's always the possibility that you're now a carrier. Also, if a member of your family is under quarantine currently because of other exposure outside your home or outside or in their place of work, or some type of exposure that somebody's documented, and you're under quarantine, or a family member of yours that you're close with is under quarantine, we do not need to see you. We want to, please call us. We'll give you some advice in terms of what we need to do, but those type of things we really do not. We want to minimize the risk to everybody here. If you've been in contact with anybody from New York City recently, we'd like you to delay any appointments here until the incubation period potentially that you've been exposed has expired. So that'd be about 2 weeks. If you meet any of those criteria, that you have fevers, upper respiratory tract infection, potential risk to somebody close to you with an infection, or recent visit to New York City, please call our office for instructions. If you're coming to the office and you need to be accompanied, only bring one person with you. We will ask any other members that you bring with you to wait outside in the car. We only have room. We'd like to maintain social distancing within the office. We do not have an unlimited amount of space for a family to accompany a patient here. So please respect only one person to accompany the patient on the day of surgery. We have removed all the magazines from the office. I'm sorry that we've done that, but we believe that would be a potential risk for people sharing these types of materials. So we've removed all that from the office. We do have a guest Wi-Fi network, and you're more than welcome to access that. Unfortunately, the network is not very strong, so you're probably not going to be able to stream your favorite program or Netflix, but at least you can get onto the internet from there. Soon, we're hoping to be bringing the ability to have a telemedicine type virtual consultations. So we're looking forward to that, adding to our ability to meet and discuss with people over the internet rather than seeing them in person. That's not quite in process yet, but we're looking forward to getting that going. In any event, that's everything for Friday, the 27th of March. Everybody out there, please stay healthy, stay safe.